Hey, pediatric champions and neuro nurses! If you've ever cared for a newborn with an exposed spine or followed a child with mobility challenges and shunt needs, you've seen the life-changing impact of Spina Bifida. Today, let's explore this congenital condition and how nurses help patients thrive from surgery to long-term support. Spina Bifida is a neural tube defect where the spinal column doesn't fully close during fetal development. It affects the spinal cord, nerves, and sometimes the brain. So first there's myelomeningocele, which is actually the most severe form. Here, the spinal cord and meninges protrude through the back, and there's a high risk of paralysis and hydrocephalus. Then we have meningocele, where the meninges herniate through the defect, but the spinal cord remains intact. And finally, Spina Bifida occulta, which is the mildest form. It's hidden under the skin with minimal or no symptoms. Common neurological deficits include lower limb paralysis or weakness, neurogenic bladder, and bowel hydrocephalus that may require a ventriculoperitoneal shunt, orthopedic issues like scoliosis or clubfoot, and sometimes cognitive or developmental delays. So, right after surgery, it's really important to maintain a sterile, moist dressing over the surgical site. Make sure the child is positioned either prone or on their side to help reduce any pressure on the area. You'll also want to closely monitor for any signs of cerebrospinal fluid leakage, infection, or increased intracranial pressure, especially if a shunt has been placed. Go ahead and administer antibiotics and pain relief as ordered, and, don't forget to provide emotional support to the parents during this time. For neurogenic bladder and bowel management, it's essential to educate caregivers on how to perform clean intermittent catheterization, or CIC. Encourage a bowel regimen that includes a high-fiber diet, plenty of hydration, and scheduled toileting. Also, keep an eye out for urinary tract infections, constipation, and any skin breakdown related to incontinence. Conduct daily skin assessments, especially over bony prominences, to help catch any early signs of skin issues. Prevent pressure injuries by making sure to reposition the child frequently. And, of course, support physical and occupational therapy for mobility devices and independence training, so the child can be as active and independent as possible. So, let's talk about shunt care, especially if hydrocephalus is present. It's really important to monitor for signs of shunt malfunction, like headache, vomiting, irritability, or a bulging fontanelle. And, we also need to educate families about the warning signs of increased intracranial pressure, so they know when to seek help right away. Nurses are, really the link between hospital care and home adaptation. We provide developmentally appropriate education to our patients, helping them and their families understand what to expect at each stage. We also support caregivers through care coordination, mental health referrals, and school advocacy. Spina Bifida care is a lifelong journey that demands a multidisciplinary team. Neurosurgeons, urologists, therapists, nurses, social workers, and above all, the family. From managing fragile spinal incisions all the way to teaching teens about self-catheterization, nurses walk every step of the journey with children and their families, turning barriers into milestones. So, have you supported a patient with Spina Bifida? We'd love to hear what's worked best in your care practice. And don't forget to like, subscribe, and follow for more pediatric and neurological nursing essentials. Because honestly, every child deserves a strong start. And remember, protect, empower, partner in care.